We'll be starting in 1 minute.
I just put the Facebook broadcast on, so it should get going here in a sec.
Hi, everybody.
How you doing?
Hi, all. Hi, Yvonne. We haven't seen each other in years. Hi, all. I'm Charmaine Ruddock. I'm going to be your moderator this afternoon. On behalf of the National Reach Coalition, I am so glad to have you sharing from the community perspective and from healthcare experts. What are the issues and concerns and questions that are being asked in the community, and then having the responses. Dr. Woolford, we're glad to have you on. I was happy to greet Patrick earlier. Yeah, we're really excited about this and want to thank you.
It's 1 o'clock, so if you guys are ready, I'm gonna let in the attendees.
Okay, Chris.
All right, here we go.
Good afternoon, all. I am Charmaine Ruddock, and I'm board president of the National Reach Coalition, who is sponsoring this first in a series of 3 webinars. On behalf of several of our collaborators who have made this possible, namely the Arizona Telemedicine Program at the Southwest Telehealth Resource Center, along with the Department of Health Promotion Sciences at the University of Arizona's Mel and Enid Zuckerman College of Public Health, the National COVID-19 Resiliency Network at Morehouse School of Medicine, Asian Media Access, and Healthy Flint Research Coordinating Center. I wish you a warm welcome to the conversation that we are having today. The National Reach Coalition, formed in 2004, hard to believe 17 years ago, is a coalition of communities of racial and ethnic populations that are addressing racial and ethnic disparities and the establishment of racial equity. Last week, as you all know, as a nation, we marked the 1-year anniversary of COVID-19, when things started to shut down. In that year to date, we've had roughly 30 million COVID-19 cases in the country. We have had the very unfortunate marking of more than 530,000 deaths of our fellow Americans. And though we have not yet turned the corner with COVID-19, we have begun to see glimmers of light that the end may be closer, or at least a manageable end may be closer than we had imagined maybe even a few months ago. And by that, I mean, with the vaccines, we now have 3 vaccines that have been approved. And because of that, 109 million vaccines have been given. 38.3 million Americans have been fully vaccinated, which is roughly about 12% of our population, and the numbers continue to improve. As I mentioned, we are kicking off a series of 3 panel discussions this afternoon. Our featured communities are from the African American community and Asian Pacific Islanders. Our experts come from the community and from the health sector, and we've decided on a town hall format that will allow for the easy flow of information being disseminated, questions being asked and addressed, and strategies being shared about how these communities have been working with their residents to elicit concerns and to address those concerns around COVID-19. I want to thank the panelists that we have here from represent the African American community. The community member here is Patrick McNeal, who is the director of the North Flint Neighborhood Action Council. Organizational representative is Ms. Yvonne Lewis, who is co-director of the Healthy Flint Research Coordinating Center, Community Care, and our subject matter expert is Dr. Susan Woolford, who is Associate Professor of Pediatrics at the University of Michigan. Our Asian Pacific Islander community, the representative from the community is, sorry, one second, is Ange Hwang. She's the Executive Director of the Asian Media Access. Organizational representative is Hyepin Im, forgive me if I've mispronounced your name, from the Faith and Community Empowerment Group. Our subject matter expert from the Asian Pacific Islander group is Dr. Shanti Narasimhan. Dr. Narasimhan, forgive me if I've butchered your name a bit in pronouncing it. Dr. Narasimhan is the Associate Professor of Pediatrics, the Fellowship Program Director for Pediatric Cardiology. And so the format that we will have with our panelists, each group of panelists will have 15 minutes to introduce themselves, speak a little bit about their work, and then we will go into a question and answer session. So please feel free, those who are attending, to post your questions in the chat. So I'm going to start by asking Dr. Hwang, I'm sorry, not Dr. Hwang, Ange Hwang from the Asian Pacific Islander community, if you would indicate who's going to start first from your group.
Thank you so much. This is Angie from Asian Media Access. We will go ahead to have this 15 minutes start with Hyepin, one of our Korean partners. She's going to present some of the information regarding the COVID-19 testing and vaccine situation at our community, and follow with Dr. Shanti, with the experts talk about some of those vaccines, why and how we should get vaccine. And then I will do a brief presentation why the cultural impacts on the different decision-making process for the vaccination. So go ahead, take over, Hyepin.
So good afternoon, everyone. Again, my name is Hyepin Im with Faith and Community Empowerment. And I would like to say a few things about just our experience with vaccination, but actually I want to say that it is connected to the larger picture of the COVID-19 impact, the disproportionate impact on the Asian community, for which I would like to highlight some points that I think are all relevant in terms of vaccination. We recently partnered with the state of California to distribute codes, and I thought by this time that many members of our community would have been connected, but I was quite surprised. We shared the codes with everyone, but there was a large number from the Asian community. I personally got my first shot the other day, and when I did go, the instructions after the fact, it was only in Spanish, and not even in English or any other Asian language. That also came as a surprise. And so I think that even when you do the call-in centers, the translation or the language assistance to help with the appointment was also, again, lacking. And it seems like there is a lack of consolidation and streamlining of sign up as well as actually getting the shot. So I just want to put that out there. And I noticed that even with our senior workers, that there is still fear. I thought that there was a better acceptance from our community on vaccination. But in South Korea, for example, the president, supposedly the Congress members, none of them have taken the vaccine. And recently someone had died from a vaccine shot, and it's unclear if they had died from that. But ultimately, at the end of the day, people were saying you should get the vaccine first before you're asking the rest of the country to risk their lives. So that type of influence from home countries, I think, are very relevant and impactful in terms of people's comfort with vaccination. And so with that, I did say that I want to share a little bit more on just the COVID-19 impact on not just the vaccination access, but again, on people's economics, whether it's their business income, where or health, infection rates. So I wanted to just go over some of those data points, as well as the racism that's also causing trauma as well. And I know that I have a limited window, so I'm just going to do what I can, and then maybe be able to answer more questions as well. So I'm going to share my screen, and I think you could see it. Is that correct? Can you see my PowerPoint?
Yes.
Okay, awesome. So just real quickly, our organization was formed 2001, and we saw that there was a lot of disconnect with the way that the Asian community is portrayed as a model minority And so what we learned was that there wasn't, our pain, our suffering is somehow invisible. And there usually then is no line for us to stand to receive these type of services, whether it's vaccine or, jobs or healthcare, etc. And so that's how our organization formed back in 2001 to do that. And as many people are aware, the COVID-19 has definitely allowed for this growing hate crimes against Asians. And it seems like it's happening every day, over 3,000 attacks since March of last year. And there are different news coverage of the racism and again, the trauma that's there. And so there was 150% increase throughout the US. In New York City, over 800%. And I think everyone's aware of the President Trump's impact. Just in terms of economic impact, which I think, again, allows, getting access to vaccine, you need time, you need freedom of thought, to room to be able to look up. Because even for me, as someone who's lived in the United States, trying to look up vaccine sites, and we're an organization that even had codes, but it was just very painful for me to sign up, let alone my husband. I'm thinking that all the seniors, right, that don't have cars, that don't have access, all those things could be very, very painful, and it's a reality. Many businesses, over 200,000 small business closures as of April of last year, let alone all that's happening now. And so in Flushing, Chinatown, it was over 96% drop. In terms of unemployment filings, but last year again at the height, you'll see that it was over 10,000% increase. Other groups, 3,000, white, 3,000, blacks, 2,000. And as of recently in New York, still Asians have the highest increase in the unemployment, but no one's talking about our community. And so I just want to put that out there in terms of even this discussion. And I think it also shows solidarity, that whether you're black, white, black, yellow, brown, that we're all kind of in the same boat. And I think there could be a stronger voice together. I'll highlight the dry cleaning business as one. 40% are owned by Asians, and more than 90% of the owners are not taking a paycheck. 50% of the owners are just paying employees out of their own savings. And you'll see here that in, again, Asian and Latino neighborhoods, the risk to the service workers for Latino is 57%, Asians 40%, Black 24%. But again, over and over again, our community continues to be erased or invisible. Here, health impact. In May of last year, Asians had the highest death rate in LA County. And you'll see then it was Black afterwards. But again, no one talks about that. Here, Pacific Islanders have the highest infection rate. And then you look here, Just nationally, Hispanics had the highest, and then Asians the next in terms of rate, and then Blacks subsequently. And again, whether it's in the major 6 cities where Asians populate or states, again, a very high percentage experiencing death. And then here, you'll see that Hispanics and South Asians have the most positive test results. But again, where's the outreach? Where is the vaccine being distributed? I don't see in the news of intentionality of including the Asian community. And you'll see here again, for most hospitalizations, African-American actually is the highest, but then South Asians and Chinese is right there with Latinos. And then in New York, Chinese had the highest death rate. So that too, oh, I do want to say why. And I was kind of shocked in terms of like the higher rates of obesity, diabetes, high blood pressure, lower income folks being in frontline workers, and not much, you know, multiple generations living in crowded housing, which I think are similar pain points with the Black and Brown community as well. And then I just want to say that, again, we're in the frontline workers. And so you'll see 1 in 4 on hospitality, leisure, retail, other services. But are there any intentionality in the multiple languages, right? Because there's a high language barrier, but are they being reached? You'll see that the 20% are doctors in our community as well. I think I just want to say, again, last piece, you know, you'll see that there was a Pew study, and they've asked the question, who is facing most racism during this period? And basically all adults said the Asians, and then Blacks, and so forth. And you'll see like greatest fear of physical attack, Asians at 26%, Blacks at 20%. And so again, there's a lot of room for solidarity here. Highest subjects of racial slurs, Asians, and then Black here. And so I just, you know, people feeling uncomfortable around them, right? Asians, Blacks were, again, very high, similar numbers. So at the end of the day, I think, again, there's room for solidarity real quickly. You know, Asians are known for a high education, so that's why they think we're successful. But you'll see in terms of promotion rates that we actually have the lowest of any group. Whether it's home ownership rate, you'll see like Korean, Hmong, Black, like one of the lowest. If you look at discrimination, home buying process, Asians, Hispanic, Black here, again, very similar in terms of rental. In terms of criminal justice, again, Asian, Black, Latino, Asian, Black, Latino, and just so forth. And so I just want to conclude by saying that we're all in this together, and we would, as a voice for the Asian American community, whether it is COVID vaccine and all the other matters that impact our health, that we welcome solidarity and partnership. Thank you.
Thanks, Hyepin. That's really a great information and setting a great stage for the collaboration. So Dr. Shanti, you're next.
Thank you so much. I'm going to share my screen. Can you guys see?
Yes.
Thank you for inviting me. I am going to talk about COVID-19 vaccine, the facts, and many people ask me the question, do I need the vaccine, and why is that? So let's start with first, you know, what is that? Before we start the vaccine, let's talk about illnesses. All of us get illness, right? We get bacterial illness or viral illness at some point in your life. So these viruses invade the body and they attack and start to multiply normally. And this we call it as illness or infection. And how does our body react to these type of illnesses or infection? The blood has RBCs, the red blood cells, and the white blood cells. The white blood cells are the immune system or the fighting, they can fight the infection. So when the first time the body encounters a germ, it takes several days to make and use of all the germ fighting tools needed to get over the infection. After the infection, the body says, the immunity that I have built, I will remember that because this is going to protect. Next time, if I have an illness, I will be ready to fight immediately. And the body keeps something called the lymphocytes, or called the memory cells, that goes very quickly into action as soon as we encounter kind of similar germs or same germs. So I'm trying to explain to you guys that our body has the defense mechanism, right, for all types of illnesses. But here we are in a pandemic situation and we need to control this infection. How can we control this infection by imitating it within our body is by giving vaccine. The vaccine does not have any live virus. It is basically has a protein. So this protein can imitate an infection within your body, and this type of infection will never cause significant illness, but it does cause immune mechanism to start producing antibodies. I'll show you more about it. Sometimes after getting a vaccine, this is an imitation of an infection. You might have some minor symptoms, and that's okay. That we can deal with it with Tylenol or ibuprofen. Such minor symptoms are normal and should be expected as the body builds its immunity. So similarly, what is this vaccine? Similar to whatever we are receiving it annually. All of us receive annual flu shots, right? Because the flu virus causes disease may be different from season to season. And every year the flu vaccines are made to protect against the virus that research suggests will be most common. So, but immunity wears off easily over time, and that's the reason why we get the vaccine every year. Getting flu vaccine every year helps us protected from not getting any type of very serious illnesses. So our body's mechanism is already saying, okay, if there is another flu virus that's going to attack my body, I have all the defense mechanism similar that my body remembers and can take care of it immediately. So coronavirus have these spikes like structure on their surface called the S protein. The COVID-19 vaccine has this mRNA that gives the cell instruction for how to make a harmless piece of S protein in your body. And then the body recognizes and starts to remember and builds an immunity, builds an antibodies that if you are exposing yourself to COVID patients or COVID individuals, then your body is ready to handle that type of defense mechanism immediately. Because if you get illness, it takes several days for the body to actually build the antibody, build the immunity. But if you're given that vaccine, the body already is generated the defense mechanism that it can immediately start working on it. So my advice is face mask, follow the same CDC instruction, distance apart, generally not in a very crowded space. So if you get into the illness, you end up hospitalizing, you'll end up being very, very sick. Instead of that, we can all mask, we can get our vaccine and stay healthy. And this is our goal, is get your vaccine similar to, and then enjoy a very nice summer in your backyard or when you're traveling. But ultimately, when you're exposing to your sun, I put this image because when you're exposing to a sunlight, you take care of protection, right? You have a sunscreen on, you have your glasses on, you have your umbrella on. How come when we are in a pandemic situation, we all have to have a defense mechanism, right? The defense mechanism is that wear mask, social distancing, 6 feet apart, and get your vaccine. Vaccine to prevent coronavirus disease or COVID-19 are perhaps the best hope for ending the pandemic. So my goal is to discuss about vaccine, wear your mask, stay 6 feet apart, avoid crowding spaces. Please wash your hands to protect against COVID-19. And thank you so much.
Thank you, Dr. Shanti. That's really a great way to lead to the final sections. Well, our time is up, but definitely I'll share very quickly. And we really want to have a good overall ideas why we are doing this, because a lot of cultural impact on the different behaviors, particularly at the Asian American communities. We really see a lot of research talk about some people may afraid of vaccine, some people may not have transportation to get to the vaccine location, but we never talk about the cultural impacts. And this is coming from the 2018 study about in Shanghai, talk about the Asian people's ideas about vaccine. So one of the major cultural factor is in most of the Asian culture, people are really thinking about is not taking any chemicals which or inject any chemical into your body, because that's very, very unnatural. We believe sickness is a natural part of life. So when you're asking them to get vaccines, they will tell you why I have to get sick to prevent sickness. So this is really a hard concept to overcome, particularly it's so rooted in the traditional culture. And also one of another concerns our community has is we have a different sizes. Asian Americans is a much more petite size. And is that vaccine dose is heavy? Sometimes is it that too much for our physical build? So I think those are really the two major things we really have to look through a cultural lens. And this is one of the surveys we can see. This one in the yellow is from the general public. In the blue is really for Chinese. And some of the questions are totally different. Like the questions we will have is, I generally oppose the vaccine. So you can see that because that's really not the custom to the Asian culture. The best way is to let the COVID-19 virus end it naturally. So natural way, once again, I believe in the natural or traditional healing. It's really, that is the basic belief among a lot of Asian cultures. So it's a very hard and it takes a longer time to explain what vaccine is and why we have to do it. Because of this time is so severe, we really have to mobilize our Asian Americans. We need that critical mass to be able to protect everyone. Without that critical mass to get vaccines, the virus will continue to harm us. So I just really want to say we have to starting to look not just the reason to get vaccine, but really look deeper into the cultural side, how we can talk about from the cultural perspective and get people feel comfortable so they know those problems, those concerns have addressed, so they will come out to get vaccine. Thank you, everyone. This concludes our Asian Americans portion of the vaccinations, and I will turn it over to our African American counterpart. Thanks so much.
Thank you, Angie. Thank you for the Asian American team's very powerful presentation. Now we're going to hear from our African American team, starting with Patrick McNeal.
First and foremost, thank you guys for having us on this call today. I wish it was a different type of call, but this is where we find ourselves. In the past, I was big on PowerPoints. I love Keynote. I would put together a presentation beyond measure. But on today, I really don't want to illuminate your mind. I literally want to see if we can touch your heart. You see, heart-to-heart conversations are the best to me. Everyone's vulnerable. Vulnerability attracts honesty, and honesty attracts soul connections, and soul connections attract change in my community. Because people have seen truth and still didn't know how to deal with it. So how do we go forward in this space that we're in? Or how would I try to tell the story from the aspect of my brothers and sisters. I would start by saying this. Ethel Barrymore states that the best time to make a friend is before you need them. And it would seem that during this season, everyone is being asked by those in power to leverage our relationships, our associations, and our links to assist others to take the vaccine. But my question isn't the need for taking the vaccine, it's not understanding the other situations that you allowed us to languish in before we even got to the vaccine. So what happens about dealing with diabetes, where we 60% more common in Black Americans than white Americans? Or what about we're 3 times more likely to die of asthma than our white counterparts? Or what about deaths from lung scarring? Or what about, despite having lower tobacco exposure, Black men are 50% more likely than white men to get lung cancer? How many times that stroke kills us? 4 times more 35 to 54-year-old Black Americans than whites? Or what about Blacks developing high blood pressure earlier in life and much higher blood pressure levels than whites? Nearly 42% of Black men and more than 45% of Black women aged 20 and older have high blood pressure. And I could throw cancer in there to say that Black men have a higher cancer death rate than white men. So these deadly 7 would be simply labeled as comorbidities in the conversation that we're having. So with all of the healthcare disparities and the heightened disease difference between African Americans and white Americans, why was it so difficult for our white counterparts to do just 3 simple things? Wash their hands, wear a mask, and safely social distance. And even to this day, no one is trying as hard of an outreach to get them to wash their hands, put on a mask, and safely social distance. And so now we go and we're really trying to deal with this idea of you want us to take a vaccine from a government that we supposed to trust, right? You have to forgive me, we from Flint. We got poisoned by our government. And so we struggle with trust. Trust is a big word in our community. And so we're having difficulty dealing with this idea that you want us to leverage our relationships with community, but no one has ever said in any of the conversations that I've had, we're willing to deal with some of the comorbidity issues that African Americans have. So once you get past COVID, we'll just go back to business as usual, right? We'll continue to let y'all die at higher rates than other people. We'll continue to let y'all live in spaces where it seems that the air that my parents breathed when they lived next to the foundry has carried over to me with my bronchitis, which carried over to my children, which are extreme cases of asthma. But no one is talking about our comorbidity. So again, remember, I started this conversation out by asking one simple question. The question was this: the best time to make a friend is before you need one. And now you want to be my friend, so you're doing this for my betterment, right? When history has told me that you've done some things that were not in my best interest. And please, and this is not to say that Black folks aren't taking the vaccine, or are we even getting access to those who want to take it? And we could even look at those numbers and see even there's a disparity in that Black people can't even get access to some of the vaccine that other folks were getting access to when you begin to look at the number of people who have been vaccinated. What am I saying about all this? I'm saying that at the end of the day, if we don't deal with the comorbidity issues of our community, if you really care about me, then care about all of me, not just the part of me that you're doing to save you, but the part of me that is to save us. See, that's why I want to speak to your heart, and I don't want to speak to your mind, because if I'll continue to speak to your mind, then my life is not as valuable as somebody else's. My children's life are not as valuable to other people. So my question, and the question that has raised up in some of the conversations I serve on some COVID task force here in our community, is just simply that, is that with everything that's happening, when do somebody want to do it just simply because they want to see me have and be able to pursue life, liberty, and the pursuit of happiness? Or is it, we need you to take this shot so that I can be safe and you can go back and live the life that you had before all this? That becomes our question, people. And I'm just tired of being tired of having to question everything that people are trying to do. But for good reason, we question. And so we're thankful for the people who have stepped up and have been willing to share their take on things and have brought wisdom to community, and that they will continue to do so. So my answer to people is, do your research, make the best quality decision that you can, and let no one force your hand either way, whether you take the vaccine or even if you don't. So with that being said, that's where I am, and many of the community members who have reluctance to trust the government. But we have some people who have done an outstanding job of trying to help to dispel and to bring continuity there. And that's where Ms. Yvonne comes in at. Ms. Lewis, take over.
Thank you, Patrick. Well, you set a great foundation for our conversation today, because many of our communities had concerns about the COVID virus, about the COVID vaccine, and really asked the question, so what do we do? Where do we go? And how do we get the information that we need? And I just want to share just quickly here with this coalition today. Again, we appreciate having the opportunity to talk to you about what's happening in Flint, Michigan with our work. I have had the privilege for the last 52 weeks, it'll be 51 this week, of being the moderator for what we call the Healthy Flint Research Coordinating Center's webinar on coronavirus. As a founding director of the National Center for African American Health Consciousness, my goal was to bring awareness about health and health-related issues to our community, particularly the African American community. Serving as outreach director for the Genesee Health Plan, where we want to make sure that all of our community members have health coverage. And then as the co-director of the Healthy Flint Research Coordinating Center's Community Corps, and in addition to being the community principal investigator for the Flint Center for Health Equity Solutions. I share all of those because I think it's important, as Patrick said previously, is developing those relationships prior to when a circumstance happens. So in 2016, 2017, in the midst of the water crisis, we stood up what we call the Healthy Flint Research Coordinating Center, which is a partnership between our major universities, Michigan State University and the University of Michigan, Michigan State University, both campuses, one in Flint and one in Ann Arbor. Michigan State University, along with community organizations, to help bring some energy around the research. Now, all of us know, as we look at this global pandemic, all of us know that research has been done and is being done, and Flint became a research mecca during the water crisis. Not new to us, as Patrick has already indicated, that these issues of health disparities have been going on for a long time. But how do we understand how to make a difference? And it was important for us that community have an intricate voice in making that happen. So the Healthy Flint Research Coordinating Center was designed to help bring forward the research. And we fast forward to 2019. In 2019, we were planning our third annual research symposium to really bring forward examples of research that was done in partnership with community. Coronavirus. March 16th, I'll never forget, March 16, 2020, after our governor had closed our state down because of the epidemic nature that we had, I would say, the epicenter of many outbreaks in our community, in our state was shut down. And so at that point, we didn't know a lot about the coronavirus. We didn't know what it meant, what it was, how it worked, and why were people being so adversely affected, and particularly in the African-American community. Because what we first heard in the early days is that African-Americans didn't seem to be impacted as much. And now we see that African-Americans were disproportionately impacted. So this Healthy Flint Research Coordinating Center partners, we stood up a community webinar on coronavirus. The goal was to give a local context to this global pandemic. How do we answer questions for our community? When the community is shut down, no schools, no transportation, stores closed, and when you have children receiving their breakfast and lunch from school, where do they go? And so as you can see here, this is an array of community agencies, organizations, and even our hospitals that came forward on a weekly basis to share with our community where resources could be found, where services could be, and what we needed to do in the midst of this pandemic. One of the things that we did, we wanted to be sure, was that we brought credible and trusted messengers. As we've often heard, who's sharing with us, who's asking us to participate, who can we trust? Big question. Who can we believe? And there were so many mixed messages that was being shared. So one of the things we did is we sought in our community credible messengers. And you can see some of those messengers here today. We have our chief public health officer from the city of Flint, who regularly came to the webinars to talk about what was going on in the city. And mind you, we still were dealing with the aftermath of the water crisis. Dr. Susan Woolford, who you'll hear from in a moment, from the University of Michigan. She's a pediatrician and also works at the medical center and is a researcher. How do we hear from an African-American physician who can tell us exactly in a way that we can understand it about this coronavirus? Then Dr. Deborah Verholden brought to us the epidemiology around it, some real important issues about what this virus means and how it interacts in community, and what does the data say, and what does the data mean? So often we hear these numbers, but it's not clear how those numbers really play out in real life. And then, of course, we reached out to some other professionals, and in this case, you'll see Dr. Paul Kilgore, who was one of the professors at Wayne State that worked directly with the Johnson & Johnson vaccine trials. And then we'd also hear from our community health, Genesee County Health Department, about the data, where to get tested first, and to get tested in our local communities, because there was a disparity there. Initially, we didn't have testing sites readily available in community, but partnering with our churches and the health department, we now have sites in the community at churches where individuals can go to actually get their vaccine within their local community. Community health centers were also a part of that. And then we moved from not knowing about the vaccine to learning about the vaccine, not knowing about the virus, learning about the virus, understanding the purpose of testing, getting testing made available in our community, and then now here's a vaccine. Questions became, if this is, and we heard warp speed, these vaccines are going to be developed in warp speed, what does that mean? And can we trust these vaccines? What does this mean? And for the first time in my experience, there was this real thrust initially, early on, let's get African Americans vaccinated. So the question is, why are we asked to be in the front of the line? Then we find out, yeah, we want to get vaccinated, but as was said, vaccines weren't always accessible and available. Now, where significant efforts have been brought forward to ensure that vaccines are available in our community at various community sites. We had even some of our physicians, when we started off with the testing was being made at one of our major locations at Wood Stadium. And now we're seeing testing done at churches, at our community, at our airport even, in different locations within the community for people to get vaccinated as well. What else happened as a result of this? We wanted to make sure that we were able to reach varying audiences in our community. So after the webinar was set up a few weeks later, we were able to have the webinar on YouTube. It's now on Facebook. And in addition, because of the community voice, we now have continuing education credits for our community health workers. And last week, for the first time, we were able to offer social work credits through Michigan State University to social workers. This is progress. It's an opportunity to reach many people across our community. And it is so important that our community members feel that the information they're getting is coming from trusted messengers. Patrick made the point. You want to reach people that typically are not reached, but the question becomes, why now? And what will happen as a result? How do we know with certainty that there is not going to be another major issue that arises as a result of us participating in this effort? So it's a continual education. It's a continual outreach. We can't stop. And again, what is important is that we provide the information so that people can make their own decision with quality, credible, and as accurate as possible information. And I say as accurate as possible because even some of our presenters have said information is changing so quickly. We want to make sure that we can give that information to you as we are learning it. This is a learning opportunity. It won't change overnight. People's minds won't change overnight. But I think if we move from talking about how resistant people are or how hesitant people are and ensure that we're going to provide them the information so they can make a quality decision, we'll see a difference in how people move forward. So one of the examples that we want to share with you today is to hear from our one of our trusted voices from our community, Dr. Susan Woolford. And I will tell you the reason we've been able to do this for 52 weeks is presentation like Dr. Woolford's, who makes it clear to community, because every session we have done is driven by community voice. We're listening to community. We're responding to the questions that they have so that they can feel confident whatever decision they make, it is based upon information that they feel is credible and that they can trust. So I'd like now Dr. Woolford to share with us some of her insights as a physician and examples of what she shared with our community.
Thank you so much, Ms. Yvonne. And thank you for this opportunity to speak with you today. I'm going to share my screen once I can. So as has been stated, it is so important to get facts out there so people can have data as they make decisions, and we're not dealing with so much information and misinformation that people find it very hard to make a decision. Like Dr. Shanti, I'm a pediatrician, so I am all about vaccines. But of course, with this one, there were so many questions. And then there are questions about variants, like, so should we get the vaccine? Because there are all these variants out there. And indeed, well, what is a variant? So what we try to do, as Ms. Yvonne has mentioned, is to try to get out there information in a way that hopefully people can get it and use it to make a decision for themselves. So for example, I'll share one of the things that we talked about in regards to mutations and variants. So we talked about that, you know, a virus is much like this, like a little fatty layer on the outside with the genetic material on the inside, which is often referred to as RNA. We think of the RNA as the recipe to make the virus. And what viruses like to do when they get in us is to just copy themselves. That's what their job is. But because they're just copying themselves and doing it pretty quickly, they sometimes make mistakes when they make that copy. And the mutation is that mistake in the recipe. So rather than saying, you know, a sprinkle of cinnamon, as this one says, here instead of green dots, it's blue dots. And so it put in 2 tablespoons of cinnamon. That mistake in the recipe is what's called the mutation. And the virus that results is the variant. And you could call it anything, but we have seen, like, for example, there's a British variant. And then, you know, with another mistake as it makes more copies, here instead of being blue and green, it goes to pink. We have other mutations like the South African mutation. With that, that's what all viruses do. But if we think specifically about the coronavirus, we know the RNA within the coronavirus is the recipe to make a virus that has these spike proteins, that S protein that Dr. Shanti spoke about. And if we think about that spike protein a little bit more, the important thing about that spike protein is that the tip of it, the end of it, is like a key, and it's able to open the lock of the cells inside our nasal passages and inside our lungs, which is why it's so important to wear a mask so that spike protein, that virus, cannot get to those cells with that little lock on it in our nose and in our lungs. But it can jiggle that lock open, and so that the virus can get into our cells and destroy them. what happens with a variant is, and the variants that we have seen with this coronavirus, is that the way it changes, the recipe changes, it changes the end of that spike protein. So rather than just jiggling the lock open, now it really fits very well, and it's able to open up that lock very easily and get that virus into our cells, which is why they're so dangerous, right? Why we should still be walking around wearing our masks. So vaccination is really important because it is like self-defense training for our immune system, training it how to be ready when it comes in contact with the actual virus. And so what happens is we get a vaccine, and what the vaccine is for at least two of the vaccines, the Pfizer and the Moderna, is it takes that genetic material, not all of it, just the part that makes a spike protein. So very important. So it cannot make us sick. It puts that little piece of the recipe into our cells, and it allows our cells to be able to make spike protein. Our bodies now see that spike protein and make antibodies, which are little caps that cover up that spike protein. So now we have all this antibody in our body, and we know how to make it just against that spike protein. So if we come in contact with coronavirus, the spike protein is there on the coronavirus, our bodies quickly make antibodies against it. And so that cannot unlock those cells. That coronavirus is not going to do us any damage because we've had the vaccine that taught us how to fight it. Problem is, if you have a variant now, that very good end that can open up those locks very easily, the question is, do the antibodies work as well that we got because of the vaccine? The studies suggest that they do work pretty well still, at least against this variant. And so we should still get the vaccine, even though the variants are around, even though those variants are a little bit better at getting into our cells. The antibodies that we get because of that we develop because of the vaccines that we have now still protect about that one. But you're asking us, what about the South African vaccine variant? That one's a little trickier because that change in the recipe also changes the end a little bit. That makes it a bit harder for the antibodies to actually block the end of that spike protein. And so they don't fit on quite so well. So maybe they're not the greatest, but it's still better than not having any vaccine at all because it can stay on, but not quite as well. But it still prevents it from opening up that lock as well as it did before. There's one other way in which these vaccines are really good boot camp training. When that material, the vaccine, gets into our cells, that lets us make the spike protein. When it does that, something else happens. Our body has these T cells that Dr. Shanti mentioned, and they learn to recognize that spike protein, and they're attracted to it, and they will kill the cell that has that spike protein on it. So not only do we have antibodies because of the vaccine, but we have T cells because of the vaccine that are ready to fight coronavirus when we come in contact with it. And so it's really important that everybody know this information so that they can make a decision about whether they want to get this vaccine or not. As Patrick said, we can't tell anyone to get it or not get it, but we would say that these are the reasons, the benefits of having it. And I'd also share that I had it both first and second doses, and it's given so much hope. I praise the Lord for the opportunity to have had it, to be able to be protected. So that's the kind of information that we share with our community every Friday at noon. You can join us at the Healthy Flint Research Coordinating Center COVID-19 webinar. And with that, I'm going to hand it back, I think, to Ms. Charmaine.
Thank you, Dr. Woolford. Thank you, amazing African-American team members, for such a powerful presentation. And again, thank you to our Asian American presenters. So I'm going to start off with a few questions, and hopefully we will start seeing some folks put questions in the chat. So Yvonne, I'm gonna start off with you because something in your presentation caught my attention. You talked several times about trusted and credible messengers. And I wanted to know and hope you can tell us what criteria did your team use, did your group use to determine who is a credible and trusted messenger? We've seen, high profile figures, movie stars, athletes, and I keep thinking, I'm not sure why they're trotting them out because I haven't heard them being experts in the area of COVID-19 vaccine. So how did you choose? What's the criteria that you all used to determine who was credible and trustworthy?
Yeah. Mm-hmm. So, thank you, Charmaine. It is good to see you.
Good to see you.
One of the things that we did, Charmaine, and the banner that we show, these are organizations that have been in our community for many years and have all partnered or sat at the tables together over the years, providing information to our community. So we reached out to the Genesee Intermediate School District, say, who is that person at the Intermediate School District that knows what's happening in the schools and can bring that information, specifically what's happening in our community. For our community health center, we have the leader of the community health center who is in the community. People know him. He lives in the community, goes to church in the community, and is making sure that services are being provided to community members. And then going to the hospitals, who is that person at the hospital that people can trust? Now, they may not have always known that individual, but when they come forward and we ask them specifically about what's going on in our community, they can relate to what's happening in our community. So we built it based upon the partnerships that we have. So, I'm going to talk to somebody that I know, and I'm going to invite somebody that I trust will share information with the community in a way that the community can receive it.
Thank you, Yvonne. Good. I'd like to pose the same question to our Asian American team members. Who is the trusted and credible messengers in your community? Is that important? And if so, how did you determine who's trusted and credible?
I'll take it first. This is Angie from Asian Media Access. And I think for our community, we are so diverse. So I think you definitely want to find a linguistic and culturally appropriate community-based agency. And we also really have a very strong tempo. I think a lot of our community member going to the different kind of temple, Vietnamese temple, Cambodian temple, Thai temple, and Chinese churches. So I think all these are really coming together as a trusted messengers who already been pre-identified in our community. But unfortunately, I see a lot of our culture messengers is they are really focusing on the community, and they may not has a bridge to the mainstream community. So sometimes the mainstream community has a difficult time to find that cultural messengers. And that's where Patrick mentioned the trust coming in. You have to befriend with our community. So when the crisis happen like this, you can immediately identify the trusted messengers. So I think this is really a good process to start. And I see particularly in Minnesota, we have already starting to see that collaboration happen from the mainstream agency, really outreach to those cultural messengers and really starting to utilizing the different languages, different cultural impacts to get the message to our communities. And we hope to see more.
guess I could add,
Thank you. Mhm.
I'll just add to that. So I think, again, trusted voices, trusted organizations, I think are very important. I mentioned in my presentation that even I think ethnic media is a trusted source, because a lot of times when communities have language barriers, mainstream outreach does not reach them. And even if they tried, it's not understandable. And so it's kind of interesting that news from their country of origin actually has great influence. And I mentioned again that in Korea, supposedly the Congress members and the president have not taken the COVID. And so here in America, there's this kind of a reverse discussion of, hey, you know, you're keeping the communities of color out. But in Korea, it's kind of like, hey, you know, why don't you do it first, right? Why don't you, president, and risk your lives first and show us that you survive and that it's good for you before you force us to take it and risk our lives. So I think ethnic media is definitely one. And then also, again, faith organizations, as an example, in the Korean community, 75% here in the US are connected to Korean churches. And so some of the congregations go from 1,000 to 8,000 live bodies on Sunday morning when before pre-COVID. And so again, they are centers of influence. And most recently, the California Office of Emergency Services, they're running a campaign kind of like Talk to Mom. And so they reached out. And so we recommended a mother-daughter team to be able to have a conversation about COVID, right? Again, to kind of foster that trust as well.
Thank you. So,
Charmaine,
Yvonne,
can
you
I
wanted to
add
say
to that
something?
too?
Sure.
That,
Go ahead.
yeah, that one of the things that was important is that we didn't ask people to talk outside of their expertise. You know, so we didn't ask a community person to try to be the doctor or to try to be the health officer or to try to be the epidemiologist. We asked the organizations to speak from their perspective where they had the information that people could trust, because they were talking about their known information. So I think that was another thing that was really important, is that people can understand that the information coming is directly from that agency, and there might be some differences across agencies, and those differences were even shared. So we took great, care in who we would invite in order to be sure we got the information to our community.
Great, thank you, Yvonne, for adding that piece. I want to stay with the messaging piece a little bit, but sort of turn it around a bit and say, we have seen so many people come out and say, well, I know why this community isn't lining up to get the vaccine, right? People are saying, speaking as authority figures on what the community is saying. My question for both teams is, how did you go to the community and find out what were the concerns and issues that they're having around the COVID-19 vaccine? How are you eliciting that information from the community in order to respond and address it? Whoever wants to jump in first, please feel free.
Well, I actually started from my own backyard with my in-laws to our senior workers. And then actually just getting the codes, like I said, I was surprised that when I sent out, so it seems like there's this dichotomy that we have to deal with both. So actually with my senior workers, I told them, like, we had codes, I told them over and over, and now it's in Koreatown. And so I'm saying, hey, it's like right in your backyard, because they were talking about transportation challenges and neighborhoods that they didn't feel safe, they don't have car. That was kind of their initial piece. But now it's literally in their own backyard. And then this fear also came about, right? That they still don't have comfort of risking their life, their health, by taking the vaccine. And then again, when we sent out the codes, the number of people who wanted desperately to have access to vaccine. So, you're seeing both, right? People who are wanting vaccine but seem to have difficulty getting it, and then there's people who have fear, and even with given the opportunity, they're reluctant to jump on board.
I would just say, Charmaine, is that, so remember, my adage is deeper than just what it is. You know, the best time to make a friend is before you need one.
Absolutely.
Because that means you always keep your feet in community. You never move both of your feet, right? It's almost like if you're playing basketball, if you move both of your feet, you're traveling. I'm not trying to travel. I'm trying to stay rooted and grounded in my community. And so because I'm hearing exactly what they're saying, from whether it's coming from church, whether it's coming from community members, whether it's coming from the barber shop, or whether it's coming from the corner store, because we try to keep our feet in community. And because we do, people already know that, hey, look, what are they saying? What are you saying? This is what they need to hear. And you take those anecdotal conversations back, and then you begin to have them with those folks like Ms. Yvonne said, who stay in their lane, who are good at what they're doing, but they also need to understand that you can say what you want to, but I'm still not trusting you. So it's something that happens there. It's about being in community and of community, even when there's nothing valuable from community. So here's my real issue, and I'll pass it back to you, Charmaine, after this. Isn't it rather funny that people, especially researchers, want to come in and research now? And so community, they've been picked and pricked and prodded and everything else, already know that. So they're fully aware of what you're trying to do. So here's the funny thing. All the doctors get paid for doing their work. All the information they get from residents, that great information, residents don't get nothing, because half the time the data don't even come back. But I'm gonna let Dr. Susan take it from there, and I'm gonna just go ahead and hit mute.
But it's such an important point, right? All community knows that. We've all been in that situation where community says, you come here, you give us a $50 meal or gift card or something, and that's supposed to be enough. You take your data and you go, and we never see you again. So I think that that has been stated enough, that those who truly are invested in community engaged work and knowing what's happening in the community really have no excuse. We have heard it, and so we should be in a situation where we're not stepping in, getting what we want for our next grant or our next paper and leaving. What we're doing is really building bonds with the community, because we are invested in that community and staying there. And so, and the payoff is great on both sides, because I know that after having years of relationship with Miss Lewis, that when we have conversations, 2 hours, 3 hours into the night, it is giving me a better understanding, and I am then better able to help. But that doesn't come because we've just known each other for 5 minutes. That comes because we have a genuine, rich connection.
So Charmaine, as we talked about before, the Healthy Flint Research Coordinating Center was already organized before Corona. Dr. Woolford is one of our co-directors from the university. And when she talks about, we're talking, Dr. Deborah Verholden and others, we're talking like Saturdays, Sundays, 10 o'clock at night, because we're trying to make sure we stay connected with community. So I know everybody's not going to do that, right? However, we can't just wait until an issue occurs for us to decide we want to partner with community, because that's when you're going to get the pushback. It is the long-term, long-standing relationships that are enduring that make a difference. Because then as community members, as Patrick talks about, as community members, we then can say to our community, other community members, we trust this person. So they're going to trust me. So I have to guard my integrity. Because if I'm giving bad information, then they're not going to trust me. So just as an example, I had a community member ask me if I would do a presentation on an issue that had not been proven. We didn't have any background information on it. So I even said to the community member, I don't think we can talk about that yet because we don't know enough. It was just the other day she called me back and said, I appreciate you not jumping out there and talking about that because you didn't really have an understanding of it. Now I know when you do bring something forward, I can trust it. And that's what makes the difference. It's not a single issue. It's multiple, and over time, building those relationships so people have confidence in what you say.
It's that trust, right? It's that trust issue that is so key to keep the community saying, I think so many of us fall into the trap of thinking we have to give an answer right away. And we don't understand the value of saying, I don't know right now. But once I have that information, or if that information ever becomes available, I'm going to make sure I transmit or send or let you have that information. Somebody wrote in a comment in the chat as you were speaking that they're hoping that part of that community engagement means also hiring from the community. Does anybody want to comment on that? I see a lot of vigorous nodding heads. Go ahead, Patrick.
I would just simply say, in my work that I do all the time, we just did some community surveys and we tried everything. We tried technology, we tried QR codes. We even had texts that went out. If you text CIM survey, it would literally take you to the website and not a soul would take the survey. We literally had to go, and our trusted partners had to go and get the people that they knew to take the survey for us. So what I learned in that is, and we compensated them for doing so. For me, that's where real partnership and collaboration comes together. So most universities, when they start grabbing this money, they think about how much they're going to take off the top. I'm sorry, y'all, I just got to say it. How much they're going to take off the top to cover their overhead, how much they're going to give the researcher and all the assistants. So by the time they get to community, there's really not a lot left. And so one of the things I try to do is I think of community before I submit the proposal, not after. So that I already know that if I get $20,000, $10,000 is going out as community remuneration. And I know that that's going to happen because I put it in with that in mind. And so I think sometimes that's what has to happen, because too often, again, we're the primary investigators. You couldn't do this work if we didn't say nothing. So we should be compensated for the work that we do. And I'm sorry, I always say we, because I would rather be considered part of community.
This is Angie from Asian Media Access. Totally agree. I think we really need that type of the cultural responsive method, including the hiring cultural and linguistic appropriate staff and community members. But I also want to take this opportunity to say we really should look into next step. It's really that cultural integration. And I think in the chat box, someone is asking how Asian Americans community and African American community can work together. And this is really that cultural integration has to happen. So it will be like just a dance. You step forward, I backwards sometimes, and I step forward and you will be backwards sometimes. So I think that type of delicate balance in this whole cultural integration system has to happen. So we would be able to talk about equity in the real sense. Right now, even for just a very simple example, the mental health healing, we're trying to get our shamans, we're trying to get our temple monks to get reimbursed as their services as a cultural healing. And it just not happen. The money still go into the Western style counseling. To maybe the counselor will have the cultural and will have the linguistic background to support that type of the healing and treatment. But on the other hand, we still need to honor that cultural healing, which is happening in our community, who are working very hard to get that trust to really hold the community together as a cultural healing process and practices, but nobody be able to support them. And if we don't talk about that cultural integration, recognize two different ends, the Western, the Eastern, excuse me, meet at the center, then it's really just functioning within an existing Western cultural framework, which is not working.
And I guess I want to jump in on that.
Mhm.
You know, it's kind of interesting that what I've seen over and over again is that when people come that are not in my framework of my world, it feels many times inconvenient. But once it's established, actually, I'm a beneficiary. So like, I don't know, like disability, you know, the bathroom, you know, the one with the larger stalls. I'm like, thank you, God. Or, you know, or sometimes like when I'm lugging my suitcase and there's a handicap, you know, a rail, like I'm going, hallelujah, right? Versus me having to lug up. I'm just giving one example. And I think we, again, as this country, again, I think all of us, we have a human tendency to just kind of hang on to what we know, and it's inconvenient to think of anyone else. But I think that if we could open up to, you know, to consider and value the gifts that other communities, cultures, individuals, you know, whatever it is that they're saying, hey, we need help, or this is valuable to us, that ultimately at the end of the day that we can all benefit. And so I think, again, uniting our voices to do that. And also, I've been in this faith-based economic development space since 2001, when President Bush announced the faith-based initiative. And I noticed that when Hurricane Sandy happened, that Congressmember Grace Meng, who grew up in the church, said, hey, you know what, houses of worship play such a significant role, especially during these type of crisis, you know, moments. They play first responders. So there should be also resources allocated to houses of worship. And I think that was kind of one of the first times that like those type of, you know, what do you call that, natural disasters, that houses of worship got included. And so again, I know for the Black and the Asian community, houses of worship play such an important role. As mentioned, the Korean community is like 75%. For, you know, maybe the Chinese community is the temples, not churches. And so if we could hear each other and then we could unite our voices, perhaps there might be more resources coming our way. And I think one more thing, I showed you in my data point that Asians and Blacks right now during this COVID-19 are facing the highest levels, right, of fear of, you know, whether we're wearing masks or being physically attacked, or, you know, a lot of that stuff. And so that comes with actually mental trauma. And, you know, what resources are out there? Who's talking about that, right? I think, again, our communities could really share. I say one more, technology, again, I think that's another area where people, I feel blessed, as much as I feel like I have technology trauma every day because, you know, it works one moment, it doesn't work the other, but I still am blessed that I could connect with individuals like yourself across the country through this, right? I have the tools to connect, but many members of our community, I think whether it's the Black community and the Asian community, many of us are not connected. And so our communities are being left behind. And so again, there's many places where if we were to unite our voices, I think that there is more resources that can come along the way.
I'd love somebody to add to what Hyepin just said. Where are some of the other places we can unite our voices? Asian and the African American community. I wonder if others have any ideas or thoughts.
This is
So
Ange.
Charmaine, sorry.
Go ahead.
Go ahead, Dr. Shanti.
I just wanted to touch base. I just want to touch base with what Patrick pointed out, was that you're here to talk about vaccine, but what about our community who was exposed to diabetes and lung disease and all those things? The best partnership that I had, I realized that Asian community also has the similar situation with diabetes and obesity. We started working much early on. My presence, our healthcare presence is very important. It doesn't matter in churches or temples. We have a free service where there's a physician available, or some healthcare team is available monthly once or monthly twice on a weekend because majority of the families, they come to the churches or temples during the weekend. We are there to just talk about it in general, not worrying about, will I have a lawsuit? Will I, this is not how we practice medicine. Fear of, asking, giving a consultation. So we had a dialogue with organizations like Seva and said, let's build the trust within the community. And we started building that. I speak about healthy living. Let's have a colorful plate. Let's talk about, as a family, what do you eat? So that's one session to talk about nutrition values, thereby trying to control diabetes, controlling obesity. So you really have to put your foot in. You have to have a relationship before you go jump into pandemic situation and say, hey, I'm here as a doctor coming and telling you, you need to take your vaccine. Nobody's going to accept me. You really have to have a bondage. How do we bring the communities together? Why can't an Asian doctor go to an African American community and say, here I am representing you guys. Let's say from your team, somebody comes in, have a dialogue. Let's have a dance too. Let's have a dance party. It's okay to have that kind of a relationship. And that's how we bridge our gaps. And that's how I have been part of the community. They don't look at me as a physician. Hey, she's there pretty much at the temple, or she's there at certain organization. Let me go chat with her in a very friendly way. And that's kind of relationship we need to start developing over time. That's probably was my experience.
And Charmaine, what this brings to mind for me, I used to say all the time that our lives are not built around the flavor of the month. And what I meant by that is when the idea comes up from a funder, we're going to talk about cancer, we're going to talk about diabetes, or in this case, we're just going to focus in on coronavirus, but we're whole people. And all of these things affect us because health is more than the absence of disease. So one of the things I think would be exciting is if we could start aligning around cultural similarities versus always looking at the differences. And if we look at those similarities, that's where we can build a groundswell of unity. And then when we see where those differences lie, it's easier to say, okay, we need to point this out. But I think if we really look closely at it, there are so many differences. When I think about faith communities, there's so many uniting pieces that sometimes get lost because there's only a focus on one piece. But if we can look at those similarities across our communities and build that synergy there, we can then minimize, I think, even heighten the power that we have as a voice for our multiple communities that are facing crises. We can move past some of this.
And I just want to again say that, particularly because of the model minority myth, a lot of times it creates, it pits kind of our community against everyone else. When in reality, actually, as I highlighted in my PowerPoint, I went really fast, but if you do look, it's all there, that we actually share a lot of the pain points, whether it's unemployment, small business, wealth, discrimination, criminal justice system, mental health. I mean, I could go on and on and on. And so I think in that way, by sharing that we actually experience similar pains living in this country, right? I think could also help break down that divide that is often present, right? There's a lot of narratives about our communities or of one another, that if we could break that down by sharing the data points in our, lived stories, experiences, I think that could also create bridges of understanding as well. Because I've seen a lot of places where we share the positive energy stuff, but then we don't ever deal with the pain. and so in that way, like in good times, we all get along, but then when the crisis hits, then everyone runs to their corner. And if we could break down some of those myths, right, I think that also helps to build genuine trust as well.
Thank you. This is Angie. Just want to respond to Charmaine's question about where other places than the worship places can be the information sharing. And we starting to training the restaurant workers and also daycare and also the grocery store clerk. We think all these three are really the information source, because when they do checkout, they chit chat with their customers. So those are the places we hope would be able to share more information, or just even grab a flyer to say, hey, this is something's happening, check it out. So those are the really, I think we should just go beyond what it's the hierarchy comes in, but really working with the grassroots, because they are definitely interacting with the waiter, waitress when they orders, they chit chat. So all those information is so valuable if we could have those people as our messengers as well.
Thank you, Angie. So I am watching our time, and I'm going to ask a question, then I'm going to ask whoever on the team to give some final thoughts they want to share with the attendees. Patrick, when you first started, you sort of went out big picture, right? You said, look, I'm not just here, I don't even want to be here just talking about COVID-19. Why aren't the other disparities being addressed? And so my question is, what would we want to see? What would you want to see? So that you excuse me, you said something that I hope I captured. Care about all of me, not just the part that is going to affect you. What should be our ask of those people who are not caring about all of us?
Well, you know, I call it the miracle moment. And so if I get to wake up tomorrow and the miracle is happening, I didn't know it took place, but if I was to view it, what I would see is that when I went to the doctor, African-Americans and others who are being mistreated will be treated fairly at the doctor, that the mortality rate for Black women who are giving birth would go up. We would begin to see that the food stamp program would be changed so that we could afford healthy food and not have to buy things that just fill us up. Because at the end of the day, I don't want my child hungry more than I worry about their health. By seeing that, we would begin to see that the policies that are on the books and the practices of those policies would begin to lend themselves to see all of me and not just a part of me. You would do the studies to find out what happened, what makes me more vulnerable to these diseases, and then give us answers that we can palate, that you would get people who look like Dr. Susan on board with you so that I can have a trusted member who's been on board with you the whole way, not a part of the way to come in, Johnny come lately, to try to get me to change my mind when we didn't have anything to do with the process. What I would begin to see is you would begin to value my humanity, and you would be ready to jettison the hierarchy of human value. So that when I see my Asian Pacific brother or sister, I see my brother or sister. I see what they look like, because I don't ever want to pretend like I'm blind, but I see them as my brother and sister, not anything else. I begin to see my Latino or my Latinx brother and sister as not my enemy or someone who is trying to steal my occupation or potential job opportunities, but someone who just wants the same thing as I do, to raise up their children, to make sure that they go and they do the right thing, that my kids have just as good a chance as others, that my kids would go to a school that looks like something that was built in the 21st century. Those types of things would begin to happen. And then all of a sudden, you would see the temperature in this country go down. Because at the end of the day, I believe that you can legislate morality. And if you think I don't know what I'm talking about, all you got to do is remember 3 letters, TSA. I remember when you used to go to the airport, you could walk somebody all the way dang near on the plane. Now, all of a sudden, you legislated morality, and all of a sudden, some people quit wearing belts because they got tired of trying to put them back on after they tried to get on the plane. So you can legislate morality. So for me, these are the things you would begin to see, and the world would be different. So you wouldn't just kick, because now it wouldn't be about you doing something for my community. You would be doing something about our community.
I know we have a hard stop and it's 2 minutes left. Anybody has a quick last word before we wrap up? Okay, then. I'm gonna take the last word to thank an amazing group of panelists. We could have done another hour and a half. There was so much here. I cannot thank you enough for launching this series. You have set such a high bar, but I know that other groups coming along will be able to meet that bar. Thank you all. One last quick reminder, folks, there is a survey that we're asking you to complete. You don't have to complete it right now, but you please complete it and send it in. The link was in there. On behalf of the National Reach Coalition and our collaborators, thank you all for an amazing, amazing presentation. Thank you much. All the very best with battling COVID-19 in your respective communities. May we all come out much better by the end of 2021. Thank you again.
Thank you.
Thank you, Charmaine. Great
Thanks
job.
so much.
you.
Great
Guys.
panelists. Thank you.
Thank you.
Amazing. Thank
Bye,
you.
everyone.
Bye-bye.